My name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization, nutrition, and exercise. My website is drdoctormedicalhypnosis.com for your own personal hypnosis videos. Today's health tip is entitled 7 Pains That You Should Never Ignore. We all get pains on and off here and there, an ache or a pain. You might have injured yourself in sport or had some sort of a trauma. That is not the type of pain we are talking about. We are talking about a severe, sudden onset of pain that is unusual and usually excruciating. So, what are these pains? The worst headache you've ever had in your life could indicate a ruptured aneurysm, which is a balloon-like formation in the arteries of the brain, or in elderly people it could be a sign of a stroke where they have bleeding in their brain. Now this calls for immediate urgent attention, and if you develop a sudden onset of severe pain that you've never had before, you go immediately to the emergency room, call 911 and go to the emergency room for evaluation. People get migraine headaches, muscle spasm headaches. These are not the same. They are not intense and severe. Accompanied with this type of headache, you could also have nausea and vomiting from cerebral hemorrhage. The next pain is acute chest pain, mainly on the left side, with the pain radiating down the arm or up into the neck and jaw or to the upper back. And this usually indicates an acute myocardial infarction or heart attack. Again, it is most important to get yourself to the emergency room within 3 hours of the attack, and then they can give you a special blood thinning agent that will prevent the clot from doing any damage. One tends to ignore things and say, it's nothing. But it's better to be safe, to be checked out, than ignore it. If the pain in the chest is severe, or it is aggravated by walking or any type of exercise, you can bet your bottom dollar that you have heart disease, coronary artery disease, and you should be seen. In females, however, they do not present with the same classical chest pain on the left side, down the arm, all the classical symptoms of a heart attack as in a male. And they might just present the females with mild discomfort in the chest and upper back, and usually they are not diagnosed. If you develop such a pain quickly, a different type of pain, do not ignore it. Rather be safe and get it checked out than be sorry and not get it checked out. Other causes of acute chest pain could be pneumonia, especially if it's located on one or other side. But pneumonia doesn't usually give you the pain down the arm or up into the neck or the jaw. There's a rare condition called an acute pneumothorax, where there is a little rupture of a bubble in a person's lung. This gives you severe pain, shortness of breath, and difficulty with breathing. Again, it is necessary to go to the emergency room immediately. The next pain that one should never ignore is acute abdominal pain. If you have an appendix or you have your gallbladder, this could mean acute appendicitis, or gallstones, acute cholecystitis, which means inflammation of the gallbladder. But any abdominal problem, pancreatitis, blockage in the bowel, there are so many causes for acute abdominal pain, I'm not going to list them all. Suffice it to say, if you develop acute abdominal pain and it's usually associated with some nausea, vomiting, or diarrhea, immediately go to the emergency room. Yes, one gets the gastroenteritis, where you have some nausea and vomiting and diarrhea, the flu bug. I'm not talking about that. I'm talking about acute, intense pain, and every person knows that this pain is not normal. Again, get checked out. Rather get checked out and found to be negative than ignore it and then have to undergo the surgery for the complications of waiting. Pain number 6 is acute pain and swelling in the calf of either of your legs. This could mean a deep vein thrombosis or a clot in the veins of the calf. The calf swells up and it becomes painful. Causes for this can be 1, being on the birth control pill. 2, after a long flight. Now, I want to spend some time on the long flight because that's the most common cause. When you're on a flight, you should remain hydrated. It is of extreme importance to flex and extend your ankles. Take a walk if you can every hour. Do not consume alcohol, as this can lead to dehydration. Those are the normal tips that the normal information given that will prevent a clot in the leg. If you have had a clot previously, then one should also use leg hose or elastic stockings to constrict the veins that they don't develop a clot. Other causes for deep vein thrombosis are pregnancy, post cesarean section, prolonged bed rest. All these can be the cause. The problem with that is that it is not so dangerous if it's just the clot in the leg. Where the danger comes in, a piece of the clot may break off and land in the lung, and that is known as acute pulmonary embolism. When that happens, you get severe chest pain, coughing, and even coughing of blood. And it's important to get to the emergency room immediately to get this treated, because we don't want that blood clot to enlarge and even lead to death. The 7th pain that you should not ignore is those vague, diffuse abdominal pain or chest pain, and the patients go to the doctor and they examine them and do all the tests and can find nothing. And it's usually labeled as depression. We do know that people who are depressed can have these pains, but we should be leery of just making the depression the cause of the pain, and special attention needs to be given to a patient with depression with regard to pain. Now, those are the 7 most important pain types that you should never ignore, and hypnosis, of course, or guided imagery does not come into this except if the patient is depressed. But immediate care has to be given in the emergency room or in the doctor's office. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.